Beyond cholesterol, how CT angiography detects hidden heart risk. One of the most common and tragic first signs of heart disease is sudden cardiac death. Many people feel fine with no warning symptoms until it's too late. That is why it is so important to assess your risk before something happens and to do it in a way that actually motivates you to take action. Doctors traditionally use risk calculators like the Framingham score or Q-risk 3. These estimate your chance of having a heart attack or stroke in the next 10 years based on your age, blood pressure, cholesterol, smoking, and diabetes. You might be told you have a 15% risk over the next decade. But here's the problem. For most people, that number feels abstract and easy to dismiss. Many focus on the 85% chance of nothing happening and delay making lifestyle changes. To make risk feel more relatable, some tools express it as a heart age, comparing your risk to that of someone with ideal health. So, a 45-year-old with high blood pressure and abnormal cholesterol might hear that their heart age is actually 60. Heart age is easier to understand than percentages, and it can modestly improve how people perceive their risk. But it still doesn't show what's really happening inside your arteries, and that's what truly determines your risk. So, what are doctors actually looking for? The answer is plaque. Plaques are fatty, sticky buildups inside the artery walls made of cholesterol, calcium, and inflammatory cells. Some plaques harden over time and calcify, but others remain soft and unstable, and it is these that are most likely to rupture and trigger a heart attack. Who should consider a CT angiography? If you want to know your actual risk beyond just estimates, CT angiography can help, especially if you have risk factors but no symptoms. It's also useful for people who are hesitant to start a statin or other preventive treatment because seeing plaque can clarify the need for therapy. It is not appropriate for people who already have diagnosed heart disease, like those who've had a coronary angioplasty, bypass surgery, or a previous heart attack. What is a CT angiography? CT angiography is a type of CT scan that uses contrast dye to visualize the inside of your heart's arteries, unlike a coronary artery calcium score, which only detects hardened, calcified plaque. CT angiography also shows soft, non calcified plaques, the ones most likely to rupture. It can even reveal specific features that make plaques more dangerous. Why does that matter? Because many people with a calcium score of 0 are told their risk is low, actually have dangerous soft plaques that can only be detected by CT angiography. We have also seen the power of this information. In the Scott Hart trial, patients who had CT angiography added to their care were more likely to quit smoking, eat better, and take the right medications. Most importantly, they had a 41% lower risk of dying from heart disease or having a heart attack over 5 years compared to standard care. So here's the bottom line: risk scores and heart age don't detect actual disease, they only estimate risk. CT angiography shows you the plaque already in your arteries. Risk scores might motivate some people to change, but seeing real evidence of plaque on a CT angiography is much more powerful and has been shown to reduce heart attacks and save lives. Because when it comes to heart disease, the first symptom should never be the last. This audio was generated using Dr. Carr's AI cloned voice.